My name is Kim Fowler. I'm the manager of the heart failure program at PinnacleHealth System.
Fowler says sometimes managing a chronic condition like heart disease can be difficult.
We're talking about conditions that patients are diagnosed with that really aren't going to go away. It isn't like having to have your hip surgery or having your appendix out. It's a condition like diabetes or heart disease or chronic obstructive pulmonary disease. They're going to be with those patients for the rest of their life. I think what makes it hardest is that there's no end to it. It's easy to do something if you know I only have to do it for a month. But for some people, and there's people who excel at this and always do the right things, but it is very hard to know that you have to do it every day.
Fowler says eating right, regularly taking medications, and staying educated are key.
We really recommend that everyone follow a healthy diet. Really, a cardiac diet is a healthy diet for everyone because it tends to be, of course, low fat, low salt. Obesity, we know, is a problem in our society, and it certainly affects your heart, makes your heart work harder if you're overweight, can cause high blood pressure, which can put you at risk for stroke, certainly affects patients that have diabetes. So in general, all patients need to eat a healthy diet. When patients are discharged from the hospital, they'll get new prescriptions, they'll get a list of the medicines to take, and if it isn't someone who has a new condition, they already probably have medicines at home, and it's very confusing. What we always recommend to patients is when you go to your pharmacy, take your list that you got from the hospital of what you're to take. If someone's well informed about their disease, then they can make choices and make decisions about what they want to do.
Tony Ross has learned how to manage his own chronic condition after being treated through the heart failure program.
Back in 2010, I was diagnosed with severe heart failure or cardiomyopathy. I entered the hospital with a heart function that was less than 10% and needed some emergency treatment. And then began a road to recovery. Had my condition not improved, I was either going to receive a defibrillator or potentially be placed on the heart transplant list as well. So it was a pretty serious situation. My condition really stemmed from a couple things. Some of it was genetic. Some of it was that I wasn't taking care of myself.
Ross says changing his lifestyle has been a big adjustment. I
was taking, I think at the beginning, about 10 pills a day. And one of the first things we were able to do was to go out and get a sort of a pill arranger or organizer and, put those things together, over the course of the week. I don't think I take 10 anymore, but I still take, several medications on a regular basis. And I've been told that, that will continue for the rest of my life, and that's okay. In terms of physical limitations, not much that I'm barred from doing, but again, as it relates to diet, I need to watch my sodium and just really be cognizant and eat in a healthy manner. But I'm still allowed to go out occasionally and have some fun, and I am from the Philadelphia area, so I occasionally can have a cheesesteak. Just can't have it on a regular basis, but no, again, because of the maintenance with the medical professionals, I'm pretty good. Anything that you have to do on a consistent basis, you get tired of, you get bored with, and I think that's the challenge, I think, for a lot of us who have these conditions, is that it's just, you sort of get tired, you get bored, and you sort of want that freedom to sort of be free to do whatever you want to do. And I think what a lot of medical professionals that I've dealt with, they kind of empower you to say occasionally, that's okay. You can be free and have a little fun. But but also it helps you when you have that freedom and autonomy to do that every once in a while. I think it makes it easier to stay on the program on a consistent basis.
What we hope to show people is that when you follow the guidelines and what helps to manage your heart, that it does help you stay well. And ultimately, our goal is for patients to be in the community, not in the hospital, and to enjoy their life. And if they follow the instructions they get, they're more likely to be able to enjoy life in a healthy way.